Come on, Mo. Good boy. Come on.
Welcome to Moments of Experience, a podcast inspired by my faithful best friend, Mo, a 14-year-old beagle who gave us moments of hope, compassion, and love during a time of tragic loss and life-threatening family illness. I'm your host, Jeffrey Smith, and I invite you to join me for powerful, uplifting, and sometimes even challenging conversations with some of the world's leading innovators in employee, patient, caregiver, and human experience. Together, we dive into the meaningful moments that shape us, move us, and inspire us to pursue our purpose in life. I'm glad you chose to join us as we explore the big and small moments that bring meaning to our lives and connect us to our true calling. Okay, welcome. I am so excited to have you on because there are so many things I want to talk about. But Michael, thank you for being here. I truly appreciate your time.
Thank you for having me. I'm excited to have gotten the opportunity to meet you. And I love the concept of moments because I talk often about moments and memories being all the things that matter and how we have this opportunity every single time in every single interaction to either make that moment a good memory, a bad memory, or a forgettable memory. And I think most of us don't want to be forgotten. And we also don't want to be the people on the cusp of creating those bad memories for people. So, let's try to create as many good ones as possible.
Yeah. And we always say that a lot of times we can be forgettable in what we say, but we're never forgettable in how we make someone feel. So I always start the show by introducing my guests in my own words. I don't read canned bios. I think they're boring. So I always introduce my guests as who they show up to me as, who they are. And Michael Goldberg is a healthcare executive, an author, a professor, a coach that creates extraordinary experiences for employees by teaching leaders to authentically connect with their people and lead like their life depends on it. And I'll have you introduce yourself in any way you see fit, how you want the audience to see you.
Yeah, I think you captured it. When we talk about introductions, it's always hard to kind of put one label to what I'm involved with and what I do and the impact in people's lives that I hope to make. And so you captured a good number of them. So after 2+ decades in healthcare, starting as an intern, ultimately becoming the CFO, Chief Financial Officer of a $1 billion business, and then transitioning to the CEO role, 5 years before anybody had an expectation of what the world was going to go through in healthcare for COVID, got to see and do a tremendous amount of understanding the human dynamic and what helps us be, live, and thrive healthy lives. And on the flip side of that, the things that maybe we don't do as well. And as part of that, that's your mental health, that's your physical health, and that's how you show up to work each and every day, whether you're supported or not. And so after the 2+ decades in healthcare, leading one of the largest hospitals in New York State and maybe even in the country, but definitely during the pandemic, leading the most impacted hospital at that first wave before any other hospital in the country was impacted, I had the opportunity to see what success looks like when there's no agendas, what a team dynamic can look like, even with people who had never come together, but when they do for a common cause that they are all rallied around. The thing that most leaders try to excel to achieve in their leadership positions, right? Getting everybody to understand their why, and then doing the things necessary to achieve it, without the distraction of personal goals, personal agendas, or anything else. And so I left that world to start to inspire companies to make those transitions, because when you look across the U.S. healthcare system and even beyond, but specifically in healthcare, we've seen over the last couple of years, 1 in 5 people leaving the industry. And when what I saw when you see 1 in 5 people, and by the way, I'm one of them, right? Full disclosure, right? It's not the people like me that I get as nervous about, but it's all the clinicians who have been burned out on the front lines, either because they dealt with a type of dynamic that they didn't expect to study when they were in medical school or nursing school, or went in to become an ACP, an advanced clinical provider, or even dietary and the laboratory. There was a different dynamic that took place either for resources being constrained or support from leadership. And that result of it is that 1 in 5 people have left the field. And what scares me more than the 1 in 5 people leaving the field are all of the people around their dinner tables for the months that they told about why they were going to leave the field of healthcare. And the generational impact that will make on the U.S. healthcare system, having the right access when we need it. And to couple that, what makes it even more challenging is the amount of people in this country who are growing in population, right? So think about it for a second. We have about 330 million people in this country, every day getting older, and we have more people being born, and then we have more people moving here from outside of the country. When you put that all together, the expected population in the United States over the next 20 years should grow to about 360 to 380 million people. What we know today in the U.S. healthcare system is that access to care is woefully inadequate. Emergency departments are packed. There aren't enough providers to provide timely care for people. The average amount of time it takes to get into a primary care visit is 2 to 4 months. And the amount of time it takes to get a psychiatric visit with a psychiatrist or psychologist is 6 to 9 months. And so if that's today, and 1 of 5 people are leaving the healthcare industry, and the number of people that will need healthcare over the next 20 years is growing, we need different answers to the questions of how we support our team members in order to inspire that next generation of people choosing their college major today to decide to choose health sciences and go into the U.S. healthcare system. Because what we need is to outpace the departures. And so some of what I do is work with leadership and companies in order to change the way that they talk to employees, they engage with employees, and they interact with employees in order to make sure that people feel valued, so that when they have that opportunity to choose who they want to work for and where they want to work, it's not just about the commercials and the PR press releases. It's about everybody in that company saying, you've got to work here. My boss is amazing. They are incredibly supportive. And it's not about just, salary and benefits. And so I created the Walkalongside Leader, which is in combination and in concert with a company called Humanistics, where we help engage from frontline managers up through executive suites on how to effectively facilitate that conversation in order to make their organizations the best place to work and inspire that next generation of leaders or even the next generation of population in this country to work in healthcare.
Yeah, and I think sometimes I think many people misspeak when they say we have a nurse or a clinician shortage. I don't think it's a shortage at all. I think it's a retention problem. That 50% of nurses are leaving, the bedside within the first 2 years of practicing because of what you talked about, the dynamic. And I think this is a really good segue, because I start the show by sharing something that truly has resonated with me about your work, or I've learned from you. And it talks, one of the things that jumps out at me that I heard you talk about is what you just referenced there. It's the changing workforce demographic and how rapidly changing it is, and how leadership needs to adapt and be innovative to support workforce well-being across multi-generations. I do a lot of speaking on knowledge transfer between baby boomers and millennials, and how do we get generations that kind of don't, quote unquote, get each other, to work together and communicate properly. And you talk about a generational shift. The largest generation, the baby boomers, have either A, retired, or B, are coming very close to retirement. And that's our largest generation. And when I look at how that impacts healthcare, as you get older, obviously, you need more care. At the exact same time, we're struggling to retain our nurses and doctors. Our biggest generation is entering in needing more healthcare. And I always like to say, healthcare is at the forefront of clinical innovation, yet lags 30 years behind the private sector in innovative people strategy. So when you try to make an industry that kind of pushes back on doing anything differently than the way we've always done it, I heard you say in a quote, and then I'm just going to let you react to this, is you said you're scared for healthcare. Can you just expand on that and talk a little bit about the process of making an industry that's very myopic and very set in their ways think differently and truly innovate as it relates to their people?
Yeah, it's interesting to hear the words when you repeat them back to me, right? Because I've said them many times, but what scares me is the lack of access for people who need care. And one of my biggest fears when we were living through the pandemic, and first you get on a phone call with the governor who says you need to double the size of your hospital because you don't see it yet, but people are coming, right? And 600 beds is a lot to double, and we had plans to do it, and I won't get into that. But what I can vividly remember feeling are the days when we were full and we did expand and we did double the size of the hospital. The door is still the same size, right? The emergency department, where most people come in, is the same size. You still roughly have the same number of people who are there. And that's an emergency department where you are getting inundated with people requiring care, not wanting it. All of the soft stuff disappeared during that time frame. So everybody who showed up actually needed care. They were in breathing crisis. And you may not have the space or the people to be able to provide it. And that was during the height of the pandemic. What's happened since, and what scares me, is when you look ahead to the next 20 years, if we don't inspire people to choose healthcare, then the number of places where people will get care, or the competency of the people who will provide that care, will be less than what we're accustomed to and what we're used to in this country. And some of that's okay. Some of that clinical shift should happen to different people, different providers, create new industries and new ways of providing care. Some of it absolutely shouldn't. One of the statistics that stands out to me is if you look at the time frame from 2020 until now versus the 15 years prior, 3 times as many hospitals have closed. And there's a period of time, and in some ways I stopped looking for this headline. There was a period of time where every single day in the headlines, another hospital was closing an OB program, another hospital was closing a mental behavioral health unit, another hospital was closing altogether, another hospital was closing an emergency department. And some of this you may say you would expect to happen, in a rural area. And some of that is true. But some of that's happening in metropolitan cities all across this country. And if we are a strong healthcare system, then we shouldn't be reducing the number of places people can receive care, as you just said, when we're going to need more of it. I think about the people, I think in Wisconsin, 2 hospitals closed their obstetrics programs within an 8-hour drive of each other. So if you were on one side or the other and you go into labor, you suddenly have to drive 16 hours in order to find a place that's going to competently, hopefully, deliver your child, if you make it there in time. This is the United States. I don't think that a lot of us think about healthcare in the terms of, I hope I'm going to have the care when I get there. When people show up in an emergency department, it is expected. One of the most tenant aspects of the healthcare system that I think everybody relies on is trust. And what we all trust is when we're in crisis or when we're in need and we show up at the door of an emergency department or an obstetrics unit in active labor, there are going to be people that are there waiting for us. And there's going to be enough of them to do so safely, compassionately, and expeditiously. And it is a foreign concept, I believe, in this country to think about the fact that that might not exist. And that's what scares me. You think about the economics behind all of it, right? From a macroeconomics system, Medicare just this year, 2024 going to 2025, Medicare just cut, the fee schedules of how much their outpatient rates are to hospitals at a time where hospitals are faced with some of the largest cost of living increases for salary increases in order to encourage people to stay that don't necessarily want to stay. So you have rising costs and not only flat in, additional revenue, but even declining additional revenue. No business can sustain that level of financial pressure on a year after year basis. And the result of it is, and I've seen this in one state specifically, they're just going to close entire programs. And what that means is less access of care for people. And so that's what scares me most is the macroeconomic impact that the healthcare system, there's always been a little bit of what I just described in healthcare, but there's also always been the ability to negotiate with the payers to then offset some of it. And that's happening less and less. And the pressures on the expense side have never been this high. And so while at the same time having a workforce who is really not satisfied in what they're hearing from their leadership in terms of support. And the result of that is they're leaving, right? And they're speaking up. More and more places are unionizing, and because they're not being heard by the people that need to hear them. And you asked an interesting question. How do we bridge the gap between baby boomers, Gen X and Gen Z? And I was just, you also mentioned I'm a professor. So I'm a professor at Hofstra University and Dartmouth College, both in the Masters of Healthcare Administration programs. And I was just at Dartmouth and heard a phrase that I hadn't previously heard, but it very much resonated with me because it's very similar to, I think, some of the work I did at Walkalongside Leader. And that's that baby boomers are effectively hiring millennial mentors, right? So some leaders are acknowledging enough to know that something has to change, and that's the first step. And what they're doing is that they're pairing up with millennials who work in their organizations, and instead of having the mentoring relationship be the more junior person getting advice from the more senior person, they're reversing the role. And I'm sure that there's a symbiotic relationship where the millennial mentor is learning a lot from the senior person, but now they're getting information about how do millennials think, what's important to them, how can I change my work environment for the better so that millennials will find this to be a rewarding place to work. And I think that's a great first step.
Absolutely. My mom was an RN for 47 years. She went to nursing school at one hospital. 48 years later, she retired from that same hospital. And it's hard, sometimes to talk to the baby boomer generation and realize that, when I do speaking engagements on it, and I get all kinds of negativity from generation to generation, but I just say, no, you're just all different. You're not this, you're not that, you're just different. And we need to communicate that because there is not someone coming into the workforce today that is going to stay the same place for near 50 years. So I always just say in employee experience, employees of all generations, but even more so the younger generations, they need to feel seen, heard, valued, just like our patients need to feel seen, heard, and cared for. And that's what keeps, from patient satisfaction, from an employee experience side, is just having that leader that you have their attention. I talk a lot in nursing. How do we work with our nursing leaders to turn a span of control into a span of attention for their people.
It's a great way to look at it.
So the name of the show is Moments of Experience, and it's named after my 14-year-old beagle, Mo, who very, very difficult time in our lives gave us moments of brilliance that really inspired us and inspired me to chase a more purposeful existence. And so, I'd like to hear your moment or moments that can be more than one that just moved you, that shaped you and inspired you to do what you do every day and teach these leaders to once again lead like their life depends on it and engage this multi-generational workforce so that we can have people choose healthcare again.
Yeah, I would definitely say there are moments, right? There's definitely many, many that have existed, and a smaller number, but still a lot that have impacted me. I think one theme, as you mentioned, the leading like life depends on it, is we only really get one shot at this, and the way that we show up to have a meaningful existence for ourselves and for our loved ones, I think is really what all we have at the end. And so you have to make the best of it for the people that are close to you, and if you're in a leadership position, for the people you serve, so that they can live out their lives in a meaningful way. I'd say the first time something really struck me along those lines was I was the chief financial officer of the hospital, and I got to get involved with a project to improve the quality of life for people living with COPD. And it was a group of us, 2 doctors, 2 nurses, and myself, who took on this goal and this challenge and partnered with everybody who's an expert in the hospital in that field. And I was learning about that field. I was relatively new to working in a hospital. I'd worked in the back office for many years on the numbers, and certainly represented and understood what the numbers represent for people's lives. But it really hit me for the first time when we had an opportunity to do an interview with a couple of patients and talk to them about their experience living with COPD. And for those of you who don't know, chronic obstructive pulmonary disorder is a reduction in the functionality of the lungs, and any lung functionality is not repairable. It doesn't regrow. Anything that you do to stop. That's why they say stop smoking, right? Because the day you stop is the day you stop harming your lungs. And it'll never be better than it is that day, but it will always be worse if you continue. And so we did these interviews, and they are actually in the Library of Congress right now under, I think it was called Storybook. And I remember this gentleman who was on home oxygen, right? He had just had a hospitalization for an exacerbation. He couldn't breathe. They rushed him to the emergency department, and they, had brought him back home, and the team did an interview with him. And he had this perspective on life that when the team was asking him about what was life like, he broke down and started crying. And what he cried about was the regret that he felt for stealing his family's future. He and his wife, they had, been married for, I'm going to say, about 40 years, and they had all of these plans. When we get old and we retire, we're going to travel and we're going to do all of these things, and wherever the grandkids live, we're going to be able to get there. And he broke down with this tremendous amount of grief and regret for having stolen that from his wife and their children, because he was homebound, and his oxygen, was effectively built into his home. And that was the first time it really hit me that the decisions that we make have tangible impacts, not only just on ourselves, but on others. And then if you fast forward about 8 years, the pandemic happened. And, being at at the place that was the most significantly impacted, how was the most significantly impacted defined by CMS? Well, it was the most number of people under critical care and the most number of people who passed away. And as a leader who is very focused on building relationships with the team and being present, I was constantly in the hospital. And anytime that the codes would be called overhead, I would respond. Now, not clinically, because I'm not a clinical person, but I would be there to be with the team. What can I help them with? What can I support them with? How are they dealing with this? There's the amount of death was something that nobody had ever experienced, and it rivaled in many ways what most veterans have seen in their lives, that have been in combat, or there's many more who have never seen it. But on average, just to put in perspective, somebody was passing away every 37 minutes at the peak. And so when I was there, for so many people's last moments, they weren't asking about the things that you would expect, right? They were asking if they were aware enough. It was, I need one more phone call with my wife, right? Because families were not allowed in the hospital. We, facilitated plenty of FaceTime calls. And here's the thing, even when people were seemingly unconscious, when the team facilitated a FaceTime call for their loved ones to say goodbye, the moment they hung up the phone, the person passed. And sometimes the passings were peaceful, and sometimes the passings were, doing all that the life-saving measures that people might have asked for. And it, that's a whole nother thing to see and experience. And what I saw in that was every single one of those people, a lot of them were young, right? A lot of them weren't the 95-year-olds, right? They were in their 50s, they were in their 60s. They were all the same guy that we interviewed 8 years earlier, who had regrets of not being able to live out their future the way that they had envisioned it. Now, this wasn't, self-induced, right? So I don't want to give that impression in any way. But what came through to me was our time is so incredibly valuable. And having the opportunity to live out as many important moments as we can with our loved ones would be where I wanted to spend my time focusing. And all the work that the team members do across healthcare in any field deserves a leader who understands that those tireless hours spent in hospitals and in practices deserve all you can give them to make sure they are having the best experience possible interacting with you and your company.
And I lost one of my best childhood friends in his 40s to COVID. So it's not all, as you said, there were so many people that had their lives stolen from them and their families, and to not be able to be there and all those things. I mean, I remember bringing my wife to the hospital at the height of this because she was in the middle of a cancer battle. And I remember an armed guard coming up to me. Like, you talk about, comparing it to a war zone, like, where do you think you're going? And that's when it hit me, what this was. This was a crazy moment that I was being looked at, just trying to bring my wife into the hospital, that I was being looked at as doing something wrong. And I was. But I had no idea the magnitude until that moment for me.
Another moment, right, that's still, I can hear when you say that, is the number of families that were torn apart at the front door, right, where the spouse or the loved one wasn't allowed in. I could hear from my office, which was behind, there's two buildings at the hospital, and my office was kind of in between them. I could hear the screams of family members saying their last goodbyes at the front door when somebody was being admitted for COVID. And I could still hear the screams because they were so visceral, I guess maybe would be the way to describe it. It was raw emotion, maybe a little bit of anger, like, how dare you not let me in? And a little bit of, I'm not ready to say goodbye. And then a little bit of, I know this is the end of the last time I'll see this person. And, as we talk about leadership, right? This came from policies that somebody wrote far away from any clinical environment. And one of the things that I think is so incredibly important in any business, and I think it's one of the reasons why that show Undercover Boss was so successful, it's because people grow in their careers. And they may have started as something, right? They may have started as a respiratory therapist and grew to be a CEO. They may have started as a frontline nurse and, they're a CNO. They may have, worked in the mailroom and now they're this, the president of the company. But we have this thing where we always reflect back and think about the positions that people are in today as what it was like when we were there. And if we're not actively, proactively getting out into the environment as it exists today, I don't think we can make appropriate decisions from the leadership levels. Our viewpoint is stale. It's gone bad, right? Doesn't mean that we're bad people, and it doesn't mean that we don't have great ideas, but the better ideas are coming from the people who are living it every day. And what we have the expertise to do is, I think, remove the barriers to make their jobs more rewarding and more efficient and more effective. And that's our biggest job, is to serve them in doing so. While, of course, stewarding a company and making sure that the direction is headed in the right place. But I think when it comes to making decisions, it never really struck me as much as when I started spending days on units or in operating rooms or in emergency departments, putting on scrubs with the team members and being there, being a part of the team, feeling the dynamic, knowing the moment where I went from being, hey, that's the CEO over there, to, just sitting around the break room, having lunch with everybody and talking to everybody about what their plans are and who's getting married and, the baby shower and the grandkids and, all of the different personal ways that people connect when they're at work. Which all become ways to build trust with the team so that they know that when you do make decisions, and sometimes they're difficult decisions, they know the person behind them.
And, in many instances, and this is why you were out there and you were in front of your people. I was once doing an all-day workshop on leadership development and employee engagement at a very large academic health system in my backyard, and coincidentally, my wife was 800 yards away from the workshop I was doing in the CHRO's boardroom being prepped for a bone marrow transplant. And when I walked across the street when we broke for lunch, my wife was crying because the food service employee that sings to her when she brings her lunch did not bring her lunch that day. And when I went back over to that boardroom, the fancy, in front of the CEO and the CHRO, and I told that story, the tenor of everything changed. I could see a CEO like, oh, wow. Like, we have employees that sing, like a singing food service. Like, what is her name? I need to go out and I need to see this for myself, because it was so amazing, because it changed the tenor of the meeting. It changed from bullet points and whiteboards to true human connection, and how the true human connection at every level of the care experience. I talk about this often, about the dynamic teams inside of healthcare that are unlike any other industry. They don't tree up to an org chart, but they all work together as touch points: food service, social worker, environmental services, all of them working together as this dynamic team to provide, in many cases, an amazing care experience, and in many cases, not so much. But my business of employee engagement, and for the last decade, specifically in healthcare, I don't even think I understood the importance of my own work until I saw it through the patient's eyes on my wife's journey.
Well, I'm sorry that you had to experience it through the patient's eyes.
Quite frankly, that was my moment that started me down a path of purpose. So I would never want to put my wife through cancer again, but it did change my perspective on collecting a paycheck versus trying every day I wake up and I try to make the biggest impact I can on those that both provide and receive care. And that's my only criteria every day. And
Great way to simplify it and know exactly what you're going to focus on each day.
Absolutely. So as we wrap up, like, is there anything else, any other, I mean, I think we've skewed a little chilling today. Certainly talking about the pandemic and everything like that. Is there any, in your leadership travels, is there any great moment of just, something very positive from someone that, and I love the way you say this, from someone that you as an executive leader served?
That's a great question. I would tell you that while I'm scared for the systematic challenges in the healthcare system, what I actually know is going to make it okay at the end is the field that's filled with so many people who care, right? Healthcare has the word care in it for a reason. And there's so many people, and I've watched, throughout 21 years or so, as in some ways a very close spectator with seats on, in the front row, this team of people who are dedicated to helping other human beings. And the people who are doing that each day inspire me. They give me hope that the healthcare system will be okay. It's up to us to solve for the systematic aspects to make their jobs, more rewarding with the capacity that it needs to have. But at the end of each interaction with a patient or their family member is a truly dedicated healthcare worker who deserves all the respect and recognition and accolades that anybody can tell them and share with them in every single moment, because what they do is hard, and many times it goes without a simple thank you, either from the people receiving the care or for the people who they do it for at their organizations, and it goes a long way to make sure that they know that they're seen. And so that's what gives me hope is all of them. The other thing I'll say on the positive side is, you can't just throw darts or throw stones at a problem or at an industry that has a problem without doing something about it. And as you started listing off some of the things that I'm involved with, I'm a board member of several companies, and one of them I want to share a little bit about just briefly, because I do think that it is transforming, or we are transforming the way that certain care is accessed and provided in this country, and that's Counselor, COUNSLR. It is a text-based mental health company that provides unlimited mental health support 24 hours a day, 7 days a week, at a very low cost. And the way that it's distributed right now is through colleges for students and faculty, and through companies for their employees. And when I joined the board of Counselor after leaving my role as a CEO at the health system, was because I saw in the phone calls that I'd received for people who needed VIP access to care, right? The number one call I would receive was for people in mental health crisis who could not get an appointment, right? I said before, 6 to 9 months to get an appointment with a psychiatrist or a psychologist. And if you do get an appointment with somebody, more and more, they're not taking your insurance. And Counselor doesn't deal with insurance. Counselor is a very low cost, as I said before, with unlimited access in 2 minutes or less, either through appointment or instantaneous. And what I love about what we're doing is we're disrupting the way healthcare is received in this country for mental health support, so that people can get the thing that they need, whether it's 2:00 in the morning when they wake up, they've got the knot in the throat, they don't know why, they don't know who to talk to, but they know that they can't get an appointment with anybody. With Counselor, they can just go right to their app and they're chatting with somebody who can help them through it in that moment. And so I'm very hopeful that some of the work we're doing at Counselor can hopefully inform some of the rest of the healthcare system to be as nimble as we are in providing access in a time that's very challenging.
That is great. And thank you. Thank you so much for being here. And thank you for truly being a servant to the people you lead. I love the way you say that, because you mentioned a few times the word trust, and, trust, attention, respect, feeling seen, heard, valued by your team leader. I talk a lot about the local team leader because that's where engagement resides. But you have shown, as a CEO servant from the front row, you have created that where you have been. So thank you for that. And thank you for showing us there are some CEOs in healthcare that are get-it people and are human-centered and do care about each and every team member and really listen to, where they're struggling, what they love, what they, what they need help with, and just being there for them and leading, like you say, leading like your life depends on it. So thank you so much for being here.
Thank you for the invitation. It was a great conversation.
Thank you for joining us on Moments of Experience. I hope today's conversation touched your heart and inspired you to reflect on the impactful moments in your own life. Remember, it's the seemingly small moments that often hold the most significant power to shape our lives and the lives of those around us. So keep your eyes open and do your best to be authentically present. If you enjoyed today's episode, please consider subscribing, leaving a review, or sharing it with someone who might benefit from our discussions. Until next time, I'm Jeffrey Smith, reminding you to cherish the moments that bring hope, connection, and purpose to your journey.